Assalamu alaikum. I am Juan Shakir Ahmed. Me and my colleagues will talk about the impact of asymptomatic carrier in transmission of COVID-19. This work is supervised by Dr. Ahmed Abdullah and Dr. Umar Nazar. COVID-19 coronaviruses are single-stranded positive sense RNA viruses. As you can see in the picture at the right side, there are protein spikes, enhanced cell invasive, on their surface that look a bit like a crown under a microscope. These spikes allow the virus to invade cells lining respiratory tract and lungs. Coronavirus in human. Coronavirus that circulate among humans are typically benign, and they cause about a quarter of all common cold illnesses. When muted, coronavirus that circulate in animal may be able to infect a human. For example, in 2002, SARS was a coronavirus that was transmitted from bats to civets and into humans. This diagram shows the possible way of emergence of COVID-19, as you can see in the slide. The previous years, coronavirus has been transmitted from bats to the camel and civet cat, then to the human being. However, in COVID-19, probably the virus has been transmitted from the bat to pangolin, then by unknown mechanism from the pangolin to the human being. Now, I will let you to continue with my colleague Amal.
Hi, I am Amal Fathi, third medical student. I will talk about the presentation of COVID-19. Patient with COVID-19 may be presented as asymptomatic carrier state acute respiratory disease, which is pneumonia. The asymptomatic carrier appear as normal person. There is no fever, no GIT symptom, no respiratory symptom. However, the transmission of COVID-19 through asymptomatic via person to person was observed in many reports. Patients with pneumonia have respiratory symptom and pneumonia on chest radiograph. This category include severe pneumonia and critical condition characterized by respiratory failure requiring mechanical ventilation. The asymptomatic carrier case were diagnosed based on positive viral nucleic acid test result without any signs or symptoms and no abnormality on chest radiograph. Thank you, and I will let my colleague Fatma to continue.
Assalamu alaikum wa rahmatullahi wa barakatuh. I am Fatma Amr, third medical student, and I will talk about case study. The infection of coronavirus started with a 20-year-old woman lives in Wuhan and traveled to Anyang. The woman was asymptomatic coronavirus carrier. On 10th of January 2020, the asymptomatic carrier met with patients 2 and 3. On 13th of January, she accompanied 5 relatives, patients 2 through 6, to visit another hospitalized relative. Patients 2 through 6 developed COVID-19. On the 23rd and the 26th of January, patients 2 through 5 developed fever and respiratory symptoms and were admitted to the hospital on the same day. On 17th of January, patient 6 have fever and sore throat. Patients 2 through 6 had PCR test results positive for COVID-19. The PCR results of asymptomatic carrier showed negative on 26th of January, positive on 28th of January, negative on 5th and 8th of February. Thank you for listening, and now I will let you to continue with my friend Abir Ghazi.
Welcome for everyone. I'm Abir Ghazi and I will talk you about the result of this case study. As we see in this table, all patients underwent numerous laboratory examinations to check on their health, such as C-reactive proteins, eosinophils, lymphocytes, neutrophils, and white BC count. Patient 1 through 6 have normal C-reactive protein level. Also, the eosinophils, lymphocytes, neutrophils, and white BC count are within normal range. That indicate why the patient has no symptoms. Patient 2 through 6 show increasing in C-reactive protein level and decreasing in eosinophils and lymphocyte count, while neutrophils is increased and white BC remain in normal range. Patient 3 through 6 also show increasing in C-reactive protein levels and decreasing in eosinophils level, while lymphocyte, neutrophils and white BC count remain normal. Patient 4 through 6 also show increasing in C-reactive protein levels and decreasing in eosinophils, lymphocytes and white BC count, while neutrophils remain in normal range. Patient 5 through 6 has the same result of the patient 4. Patient 6 show increasing in C-reactive protein level and decreasing in eosinophils and lymphocyte level, and white BC count remain normal, while neutrophils increase to 8.21, a sign that the patient has an infection, since it plays a role in healing body damage and resolve infection. So, we conclude that all symptomatic patients have increased C-reactive protein levels and decreasing in lymphocyte level. Conclusion from the study: coronavirus can be transmitted through the asymptomatic carriers. The incubation period range from 0 to 24 days. The result of test could be false negative due to the error in preparation of test and method. Now, I will let you to continue with my colleague Saja.
Hello, I am Sajah Mohammed. I will talk about asymptomatic carrier transmission. Asymptomatic carrier transmission is common. According to the World Health Organization, 75% of people in China who were first classified as asymptomatic later developed symptoms. That means technically pre-symptomatic transmission is what's probably common. Children also could be asymptomatic carriers. In 3 Chinese hospitals, among 36 children who tested positive for coronavirus, half of those had no presenting symptoms. Asymptomatic infection is common in children, occurring in 10 to 30% of cases. The time from the moment of exposure to an infectious agent until signs and symptoms of a disease appear is different from one disease to another. These are incubation period of some viral respiratory infections. Number 1, coronavirus. The incubation period between 2 days and 14 days. Number 2, adenovirus. Incubation period between 4 days and 8 days. Number 3, rhinovirus between 2 days and 4 days. Influenza virus between 1 and 4 days. Parainfluenza virus between 2 and 6 days. Measles virus between 8 and 14 days. Human non-SARS virus between 2 and 5 days. SARS-associated virus between 2 and 10 days. Respiratory syncytial virus between 3 and 7 days. Now I will let you with my partner.
Hi, I am Hala Khalid, third medical student. Now I will talk about outbreak information in Singapore and Tianjin. Study for COVID-19 in incubation period. First, in Singapore, the median incubation period is 6.55 days, calculated from the last possible exposure. And in Tianjin, the median incubation period is 8.62 days. Timing of infection in relation to symptoms. In Singapore and Tianjin, infection occur 2.89 and 2.55 days before the symptoms onset of infection. In this picture, we see the ability of infection to transmit from the carrier to victim before even appearing carrier symptoms. Now, I will let you to continue with my colleague Ali.
My name is Ali Faris and I will talk about role of asymptomatic carrier of COVID-19 in familial infection study. Familial cluster of 5 patients are involved in the study. 3 of them had returned from Wuhan. 2 of them that they had not traveled to Wuhan also infected by COVID-19. One previous study reported a family cluster with an asymptomatic transmission of COVID-19. Methods. A familial cluster of 5 patients associated with COVID-19 was enrolled in the hospital. We collected epidemiological and clinical characteristics, laboratory outcomes from electronic medical records, and also verified them with the patient and their family. Among them, 3 family members had returned from Wuhan. Additionally, 2 family members, those who had not traveled to Wuhan, also contracted COVID-19 after contacting with the other 3 family members. Now I will let you with my colleague Imad.
Hi, my name is Imad. I am a medical student in third stage. I will talk about results of cases. Case 1 developed severe pneumonia and was admitted to the intensive care unit. Case 3 and Case 5 presented fever and cough on days 2 through 3 of hospitalization and had ground glacis obesity changes in their lungs. Case 4 presented with diarrhea and pharyngalgia after admission without radiographic abnormalities. Case 2 presented no clinical, no radiographic abnormalities. All five cases had increasing level of C-reactive protein. This picture explains asymptomatic COVID-19 transmission in families. 3 of them, they had returned from Wuhan, China. 2 of them, victims, they had not traveled to Wuhan, China. But 2 of them, victims, after admixture with 3 persons asymptomatic carriers, they infected by COVID-19. Thank you for listening.